Hello and welcome to Arbutus Medical's Case of the Day, where we talk about all things skeletal traction. My name's John Konoski, an ortho trauma PA and medical science liaison for Arbutus Medical. Today, we're going to focus specifically on what does skeletal traction do. Let's get into it. Today's case of the day is from a patient that was seen on June 13th, 2022. It's a 29-year-old male with no reported past medical history who presents with right thigh pain after being involved in a high-speed motor vehicle collision at approximately 60 miles an hour. He was brought in by EMS. Patient does not remember the incident. Patient currently endorses right lower extremity pain to the right thigh that's worse with movement. Patient denies any numbness, tingling to the right lower extremity. Here we see our initial femur fractures taken at 4:17 in the morning. On our AP, we see that we have a proximal 1/3 femoral shaft fracture just below the trochanters. We see the lateral on the right with a significant amount of shortening of about 35 millimeters measured there. The patient had a tibial skeletal traction pin placed. And at 5:22 a.m., a mere hour later, the AP of the femur reveals that the fracture is significantly improved in alignment, and we are already shortened less than 1 centimeter than what we were initially. We went from 35 down to 26. So in that hour from 4:17 a.m. until 5:22 a.m., we were able to gather all of our supplies for skeletal traction, apply the pin, apply the weights, and start to reduce this fracture, which obviously is going to make our patient feel much better. The patient was then taken to the operating room later that day at about 2:30 in the afternoon, and we see that we had a long intermedullary nail placed into the right femur. So how were we able to do this so efficiently? With the Arbutus Medical Skeletal Traction Procedure Kit, as we have shown here. This kit is intended for use outside of the operating room. It allows for efficient skeletal traction pin placement without having to gather all of the necessary supplies. It allows for a single person to apply the pin without help. It allows for the drill to be reused without having to undergo re-sterilization. It allows for more accurate pin placement with the aid of the pin guide. Pin tip geometry coupled with the power and torque of the DeWalt drill make for fast pin placement. A lithium-ion battery will hold its charge for a prolonged amount of time, and the charge indicator lights ensure that the battery does not stop during the procedure. If you have any more questions, please feel free to reach out and let us know. We'd be glad to help. Thanks so much.